catheters. So the word catheter comes from a Greek word kathinani, which means to send down. So what is the purpose of a catheter? It is to track down through a vessel, to access the lesion, to cross the lesion atraumatically, and to provide support for the interventional device like balloons and stents. So catheters can be divided into various ways. Based on the usage, it can be divided into diagnostic and therapeutic catheter. And based on the size, microcatheters are defined as size less than 3 French. And based on the tip configuration, also it can be divided into multiple ways. So basic difference between a diagnostic and a gate catheter is that diagnostic catheter has got a thicker shaft with a small internal diameter, whereas the gate catheter has got a thinner shaft with a larger internal diameter, which allows the more devices to pass through it. Usually, gate catheters have a non-tapering tip, and it is more reinforced and having multiple layers for more stability. Whereas the exchange catheter is usually a straight and long catheter, maybe of length 65 to 150 centimeter, and it is usually used to exchange one type of guide wire for the other, and it is also used in interval arteriography to access the result of an endovascular procedure. The other way, the selective catheters have different kind of head shapes which are used to direct a guide wire into a specific location. Whereas flush catheter is used in general arteriography, which has an end hole and multiple side holes for the high flow administration of contrast, varying from length from 65 to 100 centimeter, and it usually have a rounded shape which promote contrast administration to multiple directions, and thus creating a blush type appearance during angiography. I will come to each end. The flush catheter have no selective cannulation of vessels because of its round shape, and it has multiple slides holes through which a uniform injection of contrast can be done, and there will be no recoil due to this peculiar shape. Usually the pigtail catheter, which is used in aortography and some specific conditions, is an example of this flush catheter. Whereas selective catheters are used for selective cannulation of vessels, and it have enough stiffness and flexibility to advance into a selective vessels, and it usually have only end opening, not the side opening as of and flush catheter. So which catheter to be used will depend on the catheter characteristics like the construction material, the diameter, the length, the head shape, and the special characteristics of each catheter. So what are the parts of a routine catheter? The catheter should have a hub, and there is a shaft, and there is a tip, which is usually radiopaque, and it has multiple curve. If it is having a simple curve at the tip, it is called a simple curve catheter, and if it has multiple curve, it is a multi-curve catheter. So what are the materials used for the construction of these catheters? It is usually made of synthetic and semi-synthetic polymers like dacron, nylon, polyvinyl chloride, polyethylene, PTFE, polyurethane, and silicone. And the radio opacities is incorporated by using materials like barium, bismuth, and iridium. So the catheters made of polyethylene have low coefficient of friction, and they are pliable, have good shape memory, and can be torqued, and are used for selective catheterization. Whereas the polyurethane catheters are softer and more pliable, but they have higher coefficient of friction. The nylon catheters are usually stiffer and tolerate higher flow rate, which are used for general arteriography, whereas Teflon is the stiffest material used for dilators and sheath. So this is the cut section of a catheter. It usually have an outer layer which is made of this polyethylene, and this gives the help to reduce the friction, whereas the reinforcement is made by the inner core, which is made of a stainless steel braiding, and which gives the torque and king resistance. In some cases, instead of steel, nitinol is used. So another diagram to show the structure of the cross section of the catheter. The outer jacket made of polyurethane, the steel braid or the nitinol inner layer, which gives the king resistance and the torque transmission. The diameter of the catheter should be as small as possible to accomplish the task at the hand. Most diagnostic angiography is performed with 4 or 5 French catheter over 0.035 guide wires. So this measurement of these these Frenches come from the French system of introduced by Joseph Charrier. One French means 1/3 of the millimeter. That means 3 French is equal to 1 millimeter. Coming to the length, the catheter length should be long enough to reach the target site and should have length outside the patient for appropriate manipulations. Commonly, all the catheters have the length ranging from 65 to 100 centimeter, but shorter and longer catheters are available for specific purposes. In general, we should use the shortest catheter that will perform the task. So based on the head shape, the various catheter can be divided and to determine the function. The first one is a pigtail catheter used as a flush catheter used in aortography. The second is a straight catheter used in exchange maneuver to allow a different guide wire to place. And the last two are, one is the selective catheter, which with a simple curve, and the last one is a complex selective catheter with a complex curve. These catheters should be designed for specific cannulation of aorta and its side branches. So flush catheters are pigtail catheters used for high pressure injection of contrast up to 1200 psi, and it has a minimal jet effect, and it will and due to its peculiar shape, it will not destabilize arterial plaque or thrombus, and it is used in aortography. And this rounded catheters is shapeable, and it can be shaped based on the position of guide wire in the catheter. If the guide wire is introduced to the tip of the catheter, the shape can be plied, and if the guide wire introduced more, the shape, the curved shape of the catheter can be splayed further. And the flexible end of the when the flexible end of the guide catheter passes outside the tip of the catheter, it starts to straighten, and by forming this particular shape, the selective cannulation can be achieved. As I said, these selective catheters have simple or complex curve, and every shaped catheter has a primary curve. And this primary curve hockey shape provides the angle of trajectory for the guide wire tip to pass through the catheter. That will allow it to cannulate from anywhere from a few degrees to almost 90 degrees from the shaft of catheter itself. Whereas a complex curve catheter has a primary curve, secondary curve, and occasionally a tertiary curve. And this complex curve catheter should be reshaped in the arterial system before it can be selectively used to cannulate a side branch. These maneuvers maneuvers must be performed to achieve the correct shape vessels. The bend at the tip of catheter confers the directionality to the guidewire tip. The hook-shaped catheter heads are also used for turning an acute angle at a tight corner. These complex curve catheter usually have a curve in one direction, then they have then back in other direction. These are selectively used to select the aortic branches for cannulations. Examples include Simmons and Headhunter cerebral catheters. The straight catheter we already seen is used as an exchange tool and for interval arteriography, and also to measure the pressure proximal and distal to a lesion. And these are also used to give stiffness to a guide wire to allow it to pass through a pass or probe a lesion more easily, and to uncoil a guide wire that has piled up proximal to an unpassable lesion. These are the uses of a straight catheter. So these are the various shape, the simple curves and complex curves which are used in cerebral angiography. So what are the different features of a catheter? The most important features are trackability. Trackability is defined as the ability of the catheter to follow the guide wire through tortuous vessels and around corners without pulling the wire out of the intended locations. Whereas pushability is description of how a force applied by the operator at the hub of the catheter, which relates to the forward movement of the tip of the catheter. Whereas crossability is the facility which a catheter follows a guide wire across the lesion or through a diseased arterial segment. Whereas steerability is the steering responsiveness of the catheter tip to the handling maneuvers performed at the hub. So an ideal catheter should have a better torque control, better pushability, flexibility, trackability, radiopacity, and heteromaticity, and low friction and kink resistance. For better torque control, the increased outer diameter will help, and more reinforced multi-layered construction will help. Whereas pushability also is increased by the increased outer diameter and stiffer material, and decreasing the overall length of the catheter will increase the pushability. Whereas flexibility is decreased by the outer diameter. And less modulus elastic substances increase the flexibility. Flexibility was also increased by increasing the overall length of the catheter. So coming to Neurogate catheter in peculiar, what are the functions of Neurogate catheters? It should act as a conduit for wire and device transport. It should support the device advancement. It should act as a vehicle for contrast injection, and also it should help in measurement of pressure. So these Neurogate catheters are usually larger, stiffer catheters through which smaller catheters and devices can be passed. It usually gets its support from the braided stainless steel core that runs along the entire length of the catheter. This added stiffness from the core helps to reduce the tendency of catheter to herniate back into the arch when the devices are passed through it. The stiffness usually varies from the length. So proximally, it is usually stiff enough to straighten the tortuous vessel which is transversing through, and provides a conduit for passing devices through to their intended targets. Distally, they are more pliable and to reduce the risk of vessel trauma and dissection. These are usually available with the pre-shaped tips to selectively introduction to a vessel, and they are relatively large and stiff, so they are only manipulated with the presence of wire or other catheter. So the Neurogate catheters are classically divided into four: the traditional gate catheters, the guiding sheath, the intermediate catheters, and the distal access catheters. So traditional gate catheters are usually generally positioned high up in the cervical vessel, and they give a good support. But they are too stiff to enter safely to intracranial vessels. So in torus anatomy, even with the higher cervical placement of gate catheter, it will not give enough support, and it will herniate back into the aortic arch while passing the stiff devices through it. So one classical traditional gate catheter is a gator soft tip, which has got a soft tip, but it is a relatively flimsy and can fall in the arch in the tortuous vessels. The other classical one which everyone uses is the 6F envoy catheter, which is relatively rigid than the gator tip, and it has got an angled tip which allows the selective navigation. The next group of guiding catheters is the guiding sheath, which is relatively more stable, which has got more larger lumen and available in different diameters and length, and have given more support to passage of more devices through it. Now, classical example is the flexor shuttle guiding sheath, which is used as a guiding sheath for the neuro and peripheral interventions, which is available in variable diameters and length, and it is the tip is usually stiffer, and which is can cause dissection and vessel injuries. And the more defined for neural procedure is the Neuron Max, which has got a 0.88 large lumen, which allows the insertion of multiple devices through it. But it has also got a softer and flexible tip, which is preventing it from which causes less vessel injury. But it is relatively, which is made of a steel platform. It can get kinked in the tortuous vessels and 360-degree anatomy. Other gate sheets are used are ballast from BALT and the destination from Thermo. And the other used one is Infinity from Striker, which has also got a large 0.88 lumen, which allows the multiple insertion for triaxial approach for clot retrieval, and the dual catheter coiling therapies are possible due to its large lumen. Then coming to the third group of catheters, it is hybrid or intermediate catheters, which are soft enough to be positioned more distally to intracranial, carotid or vertebral segments. It has got a braided metal core like the traditional guide catheters, but it is softer near the tip to make it less traumatic. Classical example is Neuron. It has a transitioning of the stainless steel segment in the proximal shaft with a platinum coil in the distal tip. So classical Neuron intracranial access device is 0.053, which allows, which has got a softer tip, and we can see that it is able to be placed in the even in the cavernous segment. Compared to the Neuromax, the classical guiding sheath, which can be maximum put up to the cervical segment. This Neuron 053 has more access, and to the even to the cavernous segment and up to the V4 segment of the vertebral artery. But the problem is that the caliber is less. So if we put a microcatheter to it, then the angiogram is not so much able to perform a good angiogram, and the tip is only radio opaque. So other products from the same is the benchmark intracranial access device, and it is more stiffer, and it has got a larger lumen, and it allows more devices, but it is less navigable than the neuron. Coming to the last group of the gate catheter, it is the distal access gate catheter, commonly known as DAC. Which are newly developed set of catheters with the extreme navigability and trackability, intended to give extra support for the neurointervention cases. The large lumen and distal access catheters also used as aspiration catheters for the treatment of stroke due to their easy and rapid navigation characteristic. They have soft, flexible distal segments for more stable intracranial placement, and proximal segments are also flexible and stable. The classical distal intracranial is the Navian, and it is made of a nitinol platform, which is made them more flexible and stable, and and this flexible proximal segment make it necessary to use a long sheet for its introduction. Other one is the catalyst, which is available as Cat 5, 6, and 7 with the various internal diameters. It is more trackable distal, and the tip is made up of nitinol and cobalt alloy, which make them more flexible. And the other distal access catheters are Sophia and Sophia Plus, which is also of large lumen, which allows the multiple devices to pass through it. Other distal access is Fargo and Fargo Max, and the suction catheters, which is commonly used for mechanical thrombectomy, are the ACE and React 71. These are also distal access catheters with this suctioning function. The balloon guide catheters are also similar to gate catheters, except that it has got an externally mounted compliant balloon at the tip. And the example is the Mercy balloon gate catheter, which is designed to arrest the flow in the internal carotid artery during Mercy clot retrieval to reduce the distal embolic complication, which is available in several sizes and lengths to accommodate the balloon occlusion of ICA or common carotid artery. So, how we should choose a optimal gate catheter for our intervention? An ideal gate catheter should have an atraumatic soft tip, excellent torque control, adequate support, and low surface frictional resistance for good trackability of devices. So, in a young patient with a favorable anatomy, the simplest solution is to use a traditional gate catheter with an angled tip, such as multipurpose curve NOI. It can be navigated high in the cervical vasculature without performing exchange or using a separate catheter. In patients with the tortuous anatomy, always consider using a gate sheath, which can be, this gate catheter can be placed inside the sheath in a coaxial arrangement for more distal access, and if required, armored sheaths can provide even greater proximal support with the compressing of vasospasm. Consider an intermediate gate catheter in very tortuous anatomy or in small caliber vessels where traditional gate catheter or sheath would be occlusive. Thank you.